Hello, my name is Dr. Lawrence Cohen. I'm the Director of Gastroenterology here at Sunnybrook Health Sciences Center and also Director of the Medical Endoscopy Unit where we're providing state-of-the-art care in imaging and treatment using endoscopic equipment. Endoscopic ultrasound is an exciting new technique to image inside the body. It's a new modality of care and treatment that we're very fortunate to have here at Sunnybrook, and perhaps we're the only center in the province that has combined this new technique of endoscopic ultrasound with a cancer center. Everyone's familiar with ultrasound. Almost everyone has had an ultrasound procedure so far in their lives. And the new technique of endoscopic ultrasound is taking that external body experience of having a probe scanning over their abdomen or their chest or wherever, and attach that probe in a new, smaller, compact way to the end of an endoscope. An endoscope is that special camera that we can use to put into people's bodies, either through the mouth or through the anus, and look inside the lining of the GI tract. When the probe is inside the body, it's much closer to the tissues and therefore gives a much more accurate profile of the tissues, either normal tissues or abnormal tissues, thereby making diagnosis much more accurate and providing opportunities for different types of sampling and treatment. And this new and exciting technique of imaging the body has advanced us to a frontier definition of imaging for GI problems. These GI problems, or gastrointestinal problems, range from inflammation to infection to cancer. It turns out that most of the indications for endoscopic ultrasound tend to be concerns about lumps and bumps that shouldn't be there, and those lumps and bumps may well be cancer. And therefore, the affiliation with the Odette Cancer Center and endoscopic ultrasound is critical as a partnership for imaging and treatment. So our plan really is to provide state-of-the-art excellence in imaging concerns inside the body, providing treatment options, and being part of a team approach to the care of patients here at Sunnybrook and the Odette Cancer Clinic. Now, our viewing audience may ask, what is endoscopic ultrasound and how do I access it and how do I know if I need it? But how do we get to that question to begin with? It depends on the way an individual presents, what their complaint is. Is it pain? Is it a lump? Is it a weight loss? Is it difficulty with some function of the gastrointestinal tract? An area of concern would be identified first. Whether it's a shadow, a lump, an ulcer, something would be seen first. Then that would be an indication for endoscopic ultrasound. Now, if it was deemed necessary, then that would be arranged by either the family physician, the referring surgeon, another referring gastroenterologist, or a general internist, where they recognize that there is a problem that needs much more refined definition and even some tissue sampling. That would be really the indication for endoscopic ultrasound when a lesion or an abnormality has already been defined, and then further evaluation and treatment would be necessary.